so when you come up for assessment in maternity assessment unit for a number of different reasons which we'll discuss, you're most probably going to come up out of these lifts, which is the normal lifts, it's not the big patient bed lifts. And then what you want to do is go left, not right, because right is the postnatal ward, so it's very unusual to be invited straight there. So let's go to maternity assessment unit. Walking into maternity assessment unit here, you'll be greeted by a member of staff who will come just from the office area here and take you into one of our bays here for examination. Sometimes you might need to come here for an assessment to see if you're in labour, if you're getting strong regular contractions, but you always need to phone the unit first on the number on the front of your notes. We need you to phone if you're having reduced or changed movements in the pattern of baby's movements that's normal for you and your baby or babies. If you have any vaginal bleeding, if you think your waters go, any pain or general concerns, we need you to call maternity assessment unit. If you have concerns regarding specifically COVID-19, we've got a specific number for that and a specific email address, and you're always welcome to phone NHS 111 for advice on that as well. Ideally, if it's a non-essential appointment, we ask people not to attend the hospital, but of course if you need us to look after you for labour or reduced movements, we're happy to see you, whether you do not have COVID-19, of course. So just to show you, this is the waiting room area at the moment. We can't show you the bays, but this is maternity assessment unit. So if you do need to come up to the labour ward at any point, for example, after being seen in a maternity assessment unit, you'll often come up the lift to level 13. This is not the med lift at the back, this is the small lift again. So if you come out the front lifts here, you'll see the doors where you can call to come in. So if you're with a staff member, we'll let you in. If not, you need to use the intercom to gain access to labour ward and we'll buzz you through. So this is labour ward. What we'll do is we'll walk you to a labour room and we'll just show you how to expect the midwives to be dressed at the moment. Because of the current situation, we're all going to be wearing at least an apron and gloves and a surgical mask. There's one of our empty labour rooms there, and we'll show you a nice lit up one.
We have everything's on this side just because we're keeping the other corridor free. So the neonatal, that's how we
Hi, hello. So this is how you can expect one of our midwives to be dressed. Sorry to ruin the So in our labour rooms, we're still going to try and create the most relaxing atmosphere as possible despite everything going on. So that's why Eleanor had the lighting nice and dim. We've got the birth balls, we've got the birth mats, we can still move the bed into multiple positions, you can avoid the bed if you like altogether. Almost all of our labour rooms have got an ensuite toilet, so you can regularly just use your toilet without having to walk through the corridor. But if you do need to walk to the corridor to anything nearby, everything is very close. For example, our one birthing pool that we have and our theatre is very close nearby. Due to the current situation, women and people can labour in the pool, but we're recommending delivery outside of the pool. And when we like to listen to baby's heart rate, we just need people to stand up rather than staying immersed in the water at the moment. But we're still trying to promote as normal birth as possible. If you do need to come to our theatre here on labour ward, as we said, it's just around the corner from all of our delivery rooms, so it doesn't take long at all, and we can show you what it looks like. So once you've had your baby, we'll bring you down to level 12, where we have our postnatal area. We'll give you a look now. So some side rooms are on the wards, but mostly people go into a bay, a 4-bedroom bay with other people, and we're being very careful at the moment with infection control and personal protective equipment. So again, midwives are going to be wearing a mask, an apron and gloves, but we're keeping it as safe as we can. For this reason, some of the postnatal visits have changed. So on day 1 of being at home, you might find that you have a phone call with the midwife to discuss future care. If you need face-to-face visit, of course we'll do it, but if not, it might be that the first face-to-face visit is day 5. The day 5 visit will involve the newborn hearing screening test that we offer, which involves taking a small blood sample from the baby's heel, and we need to weigh babies on day 5, so we're always going to do a face-to-face visit then. In between, it'll be individualised care to your situation and what needs to be done. We'll do your last appointment where we discharge you to the health visitors around day 14, which is a slight change due to COVID-19. But we can't wait to meet you and look after you, and we're really excited, and we're still here for you despite everything going on.